So the take-home message is, number one, CAR T cells are just not as good in terms of discovering or finding, identifying very small numbers of antigens compared to T cells. I mean, CAR T cells are T cells, but they detect their target using a CAR as opposed to the T cell receptor. And the T cell receptor is an old machine. It's about 500 million years old, has gone through evolution, is a superb machine. And the T cell receptor, or with the T cell receptor, a T cell is capable of detecting a single, remember that, a single antigen on a target cell. A CAR T cell using its CAR needs about 1,000 times as many antigens. So there's a huge gap in sensitivity. And the reason behind is, in a nutshell, the T cell receptor is uniquely capable of transducing the binding event into a signaling response. And that's what the CAR is not as good at. And that's why we see this reduced sensitivity, which will ultimately play a role when patients that are treated with CAR T cells later on relapse because the tumor has downregulated the tumor-associated antigen against which the CAR is directed against. And so once you are below a certain threshold, the CAR T cell no longer responds. The T cell would still respond, but the CAR T cells no longer does it. And as a consequence, there is, let's say, a niche for escape, for tumor escape, due to antigen downregulation.